Greetings everyone, Dr. Taylor Temnick here with All Care Medical Consultants, and in today's Supplement of the Month video, I'll be featuring Thorne's D5000. Now, in this video, we'll talk a little bit more about what's in the product. We'll talk about the benefits of vitamin D, as well as what too much vitamin D and vitamin deficiency look like in the body. So for starters, vitamin D can be obtained naturally either through sun exposure or dietary sources. D2 can be absorbed by plants and fungi, such as wild mushrooms, or D3 can be absorbed through animal products, such as beef liver or fatty fish, like tuna or salmon. When we're looking at the benefits of vitamin D, there's a vast variety that we're actually going to see. Now, for starters, we know that vitamin D helps calcium absorption by modulating the levels of phosphorus and calcium within the body, improving bone mineralization. Second, we know that it helps with autoimmune conditions and also helps decrease inflammation within the body. Another benefit of vitamin D is that it maintains healthy skin while also promoting muscle strength and function over time. We also know that adequate levels of vitamin D regulate blood pressure as well as mood and depression. Another benefit may be seen in how vitamin D can help with glucose sensitivity and insulin resistance, and we know it's vitally essential for fetal development during pregnancy. So now that we've talked about the benefits, let's talk a little bit more about Thorne's D5000. So within D5000, it contains 5,000 international units of vitamin D or 125 micrograms of vitamin D. Now the government's recommended dietary allowance is 600 international units or 15 micrograms. So how do I know if I need a supplement? Now, what the best thing to do is to work with your provider and identify what your current levels are. You can do this by taking a 25-hydroxy vitamin D test, and that way you and your provider can identify whether you have enough vitamin D in your body or if you might need a supplement. So when I'm looking at vitamin D, the thing to remember is that vitamin D is a fat-soluble vitamin, just like vitamin A, K, and E. Now, unlike my water-soluble vitamins that dissolve in water and get excreted through urination, fat-soluble vitamins don't function the same way. So when I'm taking a fat-soluble vitamin, when it gets broken down in the body, it's going to be absorbed by fat globules and get stored in excess in the liver or in fatty tissue when it's not being utilized. So when I'm looking at this, I need to be cognizant of having too much or excessive vitamin D. So what could that look like? Because it could be toxic. You'll see signs of nausea, vomiting, excessive urination, muscle weakness or pain, confusion, loss of appetite, dehydration, or even kidney stones. You want to make sure that you're working with your provider and you know what those lab results are for your vitamin D, especially when we're looking at taking such high doses, because your diet could be supplementing those for you. Now, on the opposite end of that, vitamin D deficiency is quite common, and there's a specific target that we might be watching that we want to check on for this. So if I have limited sunlight exposure, if I wear an SPF of 8 or greater, if I'm obese, if I'm over the age of 50, or if I have a chronic health condition such as bowel disease, I'm going to have an inability to absorb vitamin D, and so that might be a cause of my vitamin D deficiency. So if I am looking at this, again, talking with your provider is an important factor when deciding on supplementing with any vitamin or supplement. The other thing to consider is that if I've got arrhythmias, electrolyte imbalance, or if I'm dealing with hypercalcemia, we definitely want to make sure that your provider is involved so that you are making the best decision for your body. So until then, make sure you stop by one of our offices, try our vitamin D5000, or consult with one of our providers and see if this supplement's right for you. Until then, I look forward to seeing you in the office, and have a wonderful day.